piece of legislation has to yield to. So we put them in there, and we also put in there some fundamental principles, like my favorite in there is do you know who the best judge of whether a treatment is working for an individual or not? The individual. Because that's used as a weapon against us now. So, for example, when Health Canada was taking E-Empower Plus off the market and all these people with bipolar disorder were extremely frightened, well, when they phoned Health Canada, when they, begged for their lives, we know because Health Canada inspectors took the stand and I cross-examined them under oath. Well, did this matter? No, it wasn't scientific evidence. So they basically told us under oath in a court of law that if your life depends on a natural health product and you're communicating, or any product, it can be any product, and you're communicating that to them, they're going to ignore it because it's not scientific evidence. So science is used as a weapon. Well, what person has, 10 years and $500 million to run a very large double-blind clinical trial? Well, none of us. So isn't it frightening that the government will ignore you when your life depends on a treatment? And so we've put in the Charter of Health Freedom, the best source of information about whether treatment works for an individual is the individual. We created a new ministry because we don't want Health Canada regulating natural health products and safe medical devices and other alternative treatments because they've got a drug paradigm which presumes everything to be unsafe, and they need to be restrictive and understand that's actually very appropriate for novel chemicals that aren't in our food chain. We actually want them to be presumed dangerous, but that mindset doesn't work for the natural health community. So we want a separate ministry, and the Charter of Health Freedom actually says that the Minister of Wellness can't be the same as the Minister of Health because we don't want the pharmaceutical lobby to be influencing the Ministry of Wellness. So to try and prevent things like trade, I guess treaties and stuff like that, codex coming in and usurping the rights the courts say we have, the Charter makes it very clear that any trade agreements do not trump these rights, do not trump the Ministry of Wellness's mandate to promote and protect our access unless the Act adopting the treaty specifically exempts itself from the Charter. Now we can't, unless we could get a constitutional amendment, we had to do that. Parliament can't tie its hands, so even the Bill of Rights you can specifically exempt. But the optics would be bad for the government if they're bringing in a treaty and the treaty exempts itself from our health rights that the courts say we have. So at least that's all we can do is try to force them. But just so you know, we're trying to, what we did in the Charter is we asked, well, what's all the tricks we could think of they could use, and we tried to solve them, right down to a balanced risk analysis. Under the Charter, you cannot take a treatment off the market if taking it off the market would cause more harm than leaving it on the market, right? Because if it's all about safety, if there's a risk, but taking it off the market will cause more harm, then you better manage that risk another way, better labeling, supervision by practitioners, however you manage that risk. But if it's about safety, balanced risk analysis. It's really just common sense. So it's the solution, and we're so proud of it because it's a positive way to solve the problems. And we actually want to get over 120,000 signatures so that we have more signatures than any petition in history, and we want to march it across the land. So I actually encourage you Charter of Health Freedom has its own website. Just Google Charter of Health Freedom. It's just www.charterofhealthfreedom.org. You can download petitions, get them filled out, send them in. And then I'd also ask, this doesn't happen in a vacuum. So I'm here because I work with the Natural Health Products Protection Association. I'd actually ask that you would support us. I'd actually ask that you would support HANS. Can you think of a consumer organization that has done more than HANS? I mean, it's incredible. But they struggle financially. If you're not a member of HANS, what's the membership, a year membership? Can anyone tell me?
$35.
$35. But it helps, and then you're on their mailing list, and you get all their updates. Like, who here can't afford $35 for a yearly membership? They also have probably the best health library in Canada, you know, if you need to do research. It doesn't happen in a vacuum. You know, the Natural Health Products Protection Association, every time we go lecturing, we lose money. We don't actually even cover our costs, and then we kind of have to wait and, you know, build up our war chest and go again. And I feel sorry for our board because we're always meeting going, well, we need to do this, we need to do that, but we have to keep waiting, just prioritizing our initiatives. It doesn't happen in a vacuum. So to actually ask, you know, we're going to, I think, ask for donations, you know, help us cover the cost. And we'd certainly, if you're a practitioner, we'd like you to, you know, call us and make a monthly donation. We can set it up so it just comes out of your account. You know, if you're just an interested citizen, even $10 a month, it makes a difference because it doesn't happen in a vacuum, and it doesn't. And I'm actually very thankful for those who do support us financially so that we can come and do things like this, because it does make a difference. And we film things like this, it gets on the web, and it makes a difference. So I implore you to become active. And I think I'll just end there. Okay. Yeah, okay. So we've been touring across Canada. Our estimate is, like, so just so you know where we've been so far, we went to Nelson. Oh, where did we go after Nelson? We went to Aurora. We did 2 different lectures, 2 different locations in Toronto. We went to Moncton, New Brunswick. We went to Winnipeg, Manitoba. We went to Penticton. We're now here. Tomorrow I'm in Edmonton, then I'm in Calgary, and then we're done. And it's just, our budget was it's going to cost us about $26,000, all the venues, promotion, all of that. And we're almost there. So we do ask, and I'll just let you fill in. Thank you very much for your time. I actually, just don't clap yet, sing on. I really do appreciate that you're willing to listen. I take that very seriously, and I prepare very hard because it's so important, like what we're going to focus our attention on. I will take questions in just a second.
Thank you very much, Ben.